sincere welcome to deans of various portfolios who always stand by us, guide us, lead us, and motivate us. A special welcome to all heads and faculty members of various departments. I warmly welcome faculty members from other colleges to the webinar. I also welcome student fraternity for the occasion. Once again, I welcome you all for the webinar. It is now my pleasure to introduce our guest speaker, Dr. S. Ramkant, Professor and Head, Department of Pharmaceutics, Karpagam College of Pharmacy, to the meet gathering. He has completed his bachelor and master's in pharmacy from KM College of Pharmacy, Madurai. He started his career as assistant professor at Annamachari College of Pharmacy, Andhra Pradesh, where he has been promoted to various positions as associate professor and head of department. He was awarded Doctor of Philosophy in Pharmaceutical Sciences by Jawaharlal Nehru Technological University, Telangana in December 2014. His academic contributions are: he has acted as an academic coordinator in Annamacharya College of Pharmacy and at present acts as academic coordinator for Bachelor Pharmacy program in Karpagam College of Pharmacy, Coimbatore. He has guided 15 postgraduate and 12 undergraduate projects. He has 54 research publications in various peer-reviewed indexed national and international journals. He had delivered various guest lectures in national and international webinars. He is passionate about interacting and motivating young minds. At present, Dr. S. Ramkant is working as Professor and Head, Department of Pharmaceutics in Karpagam College of Pharmacy, Coimbatore. It's a great pleasure for us in welcoming you, sir, and we are ready to imbibe your words of thoughts now. Over to you, sir.
Thank you, ma'am. Thank you for your nice introduction. Let me start sharing my screen. I hope the slide is visible. Is it?
Yes, sir, it's visible, sir.
Yeah. Let me start it. Fine. Before going to the slide presentation, I thank the organizing committee for giving me the opportunity to share my views in this topic: significance of nutrition in maintaining health and preventing diseases. So, being a pharmacy background profession, so the audience don't need to think that I'll be speaking much about COVID, because we have been almost fed up for the last 6 months about speaking about COVID. I assure you that this presentation will be having not more than 2 slides related to COVID. Apart from it, mostly it will be a presentation related to the health as well as the food habits, what we are having and what we have been missed at present. So with this, let me go on to the presentation in detail. So let us first express our sincere gratitude to the frontline workers to this COVID situation: doctors, nursing staff, pharmacists, dietitian, health workers, scientists, researchers, educationalists, government and NGOs. So my presentation, the most of the content has been available in print and electronic open sources. This content has been discussed, or whatever the content has been discussed, or a personal understanding and interpretation of my presentation only, as I have included various ancient Ayurvedic concepts in these cases. So word pronunciation or typographical error and any other low information which is accurate, please apologize the same. The concept, formula, calculation, if anything is illustrated, the participants must get first-hand information prior to the application of the same in practice. For any such application and further consequences, neither the presenter nor the institution belongs to the liabilities. Well, this is a normal disclaimer. Let me go to the session flow today. So the session is majorly covering about, as I promised earlier, it won't be much about COVID. And I know that the students are much tight with their academic schedule for the past 3 hours from the morning session onwards. I hope the session won't be boring, and it will be a slightly a mind-storming session for you all. The session flow will be of in such a way that about health, what is health and what is the disease prevention method, what are the various lifestyle management that could support us to act as a medicine for having a healthy life, and about dinacharya and some formulation related to COVID, and finally some carry home message for the current and the next generation. So before going in detail about what is health, health is a state characterized by anatomic, physiologic, and physiological integrities, ability to perform personally valued work, family, and community roles, ability to deal with physical, biological, psychological, and social stress. So this is what a health is. We commonly think that if I'm not having any fever, okay, I'm healthy. It's not like that. Whether it is a fever or it is a chronic disease, whatever may be, complete free from stress or family, work, or community roles. That is what about it. In 1948, WHO has been proposed a definition of linking with the above point. It is of physical, mental, and social well-being, and not merely about absence of disease or infirmity. So health is a source of for everyday life, not the objective of living. It's a positive concept emphasizing the social and personal resources as well as the physical capacities. Well, the topic what I'm trying to discuss today is not only a topic of today's interest. It is a topic which is related to the past, present, and future, and also from generation to generation. A common saying is that prevention is better than cure. So the concept, what I'm trying to discuss today is nothing but a lifestyle management or lifestyle medicine, which is an evidence-based approaches for preventing, treating, and even reversing diseases by replacing unhealthy behaviors with the positive ones. As a lifestyle management, as I said, eating healthy, physically being active, avoiding risk substance abuses, adequate sleep, managing the stress, and some intermittent fasting, this supports a lot. So this health is not a concept which has been initiated in recent days. We are ancient. Luckily, we Indian ancient peoples. They have the habit of taking everything in a right way. Means taking the foods in a right way. That's what, as Hippocrates says, "Let food be thy medicine, and the medicine be thy food." But this statement has been reversed in recent days. Let medicine be the food and food be thy medicine. Like that, it has been changed over. So we are mostly any old persons above 50 or above 60. They used to have always a pouch with them with a list of medicines right from morning, afternoon, night. They used to take a minimum of 10 to 15 tablets or capsules or injections per day. So this is what, due to some disturbances which has been happened in between due to various factors in our food habits, which leads us to this condition what we are facing today, the complications. And I think that all the audience will be agreeing that ancient days they don't have this many medicines because they take food as a right medicine. And based on Vedas, there are 4 Vedas: Rig Veda, Samveda, Yajurveda, and Atharveda. They describe different cereals and grains which has to be used in their daily life. And the other aspect about Aryans, they also find that it is not simply by body nourishment, it also related to some cosmic moral cycles. Based on the time cycles or based on the various other factors, the food also get varied. And Orients classified the food materials as cereals, pulses, fruits, vegetables, milk products, alcoholic beverages, and animal products. So these are some classification based on the time cycle they used to take the respective food material. For example, In case of any winter season, they used to take some of fat-oriented food materials. In case of summer season, they used to take some of milk products or any other food which possess a better healthy to the hot climate like that. So saying about eating healthy, according to the Ayurvedic concept, food is responsible for different aspects of individual, including physical, temporal, and mental status. We simply say that the same thing nowadays it has been reformed. What is in the sense? If you are immediately very in a happy mood, we used to have some coke or biryani, something like that. But the same thing in olden days, they used to take the food based upon their psychological or mental status that has been classified. That let us discuss in the coming slides. And imparting this, they say that is a imbalance in mind, body, or spirit that will be leading to disease. It's not that only the climatical changes causes disease to us, or else due to some other flu we get diseases. Even if you are not mentally healthy, you will be getting some diseases. And a traditional wisdom may be having its preservative techniques and its therapeutic effects, and it's establishing it from generation to generation. Naturally or unfortunately, all our Indian traditional foods has various functional foods in it, such as antioxidants, fibers, probiotics, all these things. It has been naturally present in all our traditional foods. And some food processing technique, what we follow, such as sprouting, malting, fermentation, these gives several health benefits to us. And these functional molecules also supports in managing our weight, blood sugar level, immunity, in all aspects. There are three gunas, as I said, based upon the mood, the food varies. So sattvic, rajasic, as well as tasamic. So ancient food has been classified based upon the mood also, based on the gunas, whatever you're having. So in case of a sattvic, they used to take some grains, beans, legumes, herbs, all these aspects. In case of rajasic, they used to take some caffeine, coffee, soft drinks, tobacco, and pepper, tomatoes, onions. And in case of tasamic, darkness as well as cold condition, they used to take some milk, fish, egg, onions, garlics, and foodstuffs which has been frozen also. So this is a clear indication that our gunas and our climatical condition, the food has been changed in ancient eras itself. Linking the ancient era with an Ayurvedic basic 5 elements, Vata, Pitta, Kapha, this has been a combination of earth, air, fire, water, and ether. A combination of ether and air is nothing but a Vata, fire and water is nothing but a Pitta, and water and earth is nothing but a Kapha. So our taste, so we have been saying commonly that arusuvai, நம்ம சாப்பிட்றதுல அறுசுவை இருக்குன்னு சொல்லுவோம். ஸோ அந்த அறுசுவைன்றதே வந்து ஒரு it's a big huge identification by our ancient person, by the brilliant knowledge, because we don't know what is the benefit in it. Nowadays we simply take only few things, whatever the pungent we used to omit it, whatever the things which are bitter we used to omit it in the food. It's not a right proportion of food. Whatever the food we are taking, it should be having a sour, salty, astringent, pungent, bitter, as well as sweet. These every aspect, everything has its own usefulness in the body. For example, sour, it processes cleansing of tissues, increasing the absorption of minerals. Whatever the minerals present, it will be getting absorbing, and it cleanses the tissues also. And salty, it improves the taste, lubricates the tissue, stimulates digestions. And astringent, it absorbs water, tightens the tissues, and dries the fats. Pungent, it supports for stimulating the digestion and metabolism. Bitter, it supports for detoxification, lightness of tissue. And sweet, obviously most of them will be favorite in it. It builds the tissues and calms the nerves. So these are all the various aspects how better these supports to our psychological as well as physiological systems within the body. This is another element chart which relates and supports for combining with the elements, its quality, it balances, its excessive aggressive, as well as the foods which has been founded. So I don't like to again repeat the same. We have the same contents in the upcoming slides. Let me go on to the following next slides. So what we are saying is about Ayurvedic. So we generally won't believe the ancient things. Few of them. I'm not saying everyone. Few of us won't be believing. We need some scientific evidence. We need some scientific proof. Only then we will be accepting it, we will be agreeing it. There are several research publications as well as findings which supports our Indian food medicine, Indian food as a right medicine or a right thing to have a healthy life. There was an article which has been published in Yale Journal of Biology and Medicine, the ancient Thali diet. So it supports for gut microbiota as well as immunity and health. This thali has different phytochemicals in it. Or plate meals அப்படின்னு சொன்னா the plate meals நம்ம Indian food systemல we won't take any one thing separately. We will take sambar, then followed by rasam, basically ஒரு புளிக்குழம்பு something. We'll have any one aspect, ஒன்னு மாத்தி மாத்தி வச்சிருப்போம். எல்லாத்துக்குமே ஒரு இன்டர்லிங்க் இருக்கு, ஒரு ப்ரொபோர்ஷன் இருக்கு. We have to take in the right stage, we have to take in the right proportion, we have to take in the right pattern. So that's what here. Let me say about it in the clockwise direction. Right from the this one dal. So this dal has phenolic acid, condensed tannins, and flavonoids, followed by spices. These supports for having phenolic acid, curcuminoids, flavonoids, and these supports for various activities. Followed by curd. This is also supporting having for various good bacteria that supports in digestion as well as various aspects. And the most important, sambar, rasam, tomato, whatever which South Indians mostly have. Even some North Indians, they used to say sambar like that, something else. But I have a supportive article next to this slide about sambar also, and an interesting fact in it. Having various components in this. And this thali is a proportion of probiotics, prebiotics, and different classes of phytochemicals, fermented foods, dals, vegetables, and spices. In this, they have been given an output at the last line. The variety of these varieties helps to restore diversity in gut bacteria and many potential prevents or reverse chronic diseases such as colon cancer and type 2 diabetes. We used to find medicines for various diseases, but we unknowingly there are good remedies in our food habits. That's what state in this thing. Yeah, regarding sambar. One when used to kid us, some person used to sambar அப்படின்னு சொல்லி கிண்டல் பண்ணுவாங்க. But there is an article which has been published from Manipal University. Sambar, an Indian dish, prevents the development of dimethyl hydrazine included colon cancer. A preclinical study has been done from Manipal University. So the components which are present here, they have been done the study in rat, and they have been finalized, and they have been given the proof that it supports for acting as anti-cancer activity. So it acts against the South Indian dish. It acts against DMH-induced colon carcinogenic agent, and there is a significant reduction found in liver GSH. That has been due to this. In this particular group, they found this level reducing in GSH, and also it has a significant changes in liver catalyzing level when compared to DMH, and they found a clinical evidence that colonic nitrate in this treated group is being controlled better. And finally, they concluded that the sambar has prevent the risk of colonic cancer when consumed in a dietary proportion. This particular words means a lot. Proportion. Whatever அளவுக்கு மீறினால் அமிர்தமும் நஞ்சு இல்ல, அந்த ஒரு பேட்டர்ன், அந்த ஒரு ஸ்டேட்மெண்ட் ரொம்ப பெர்ஃபெக்டான ஸ்டேட்மெண்ட். நம்ம எல்லாம் நல்லதுன்னு சொல்லிட்டு we can't take a lot, we can take a huge quantity in it. There is a right proportion. That is what the lacking of knowledge which we have are facing in this era, particularly in the food. நம்ம இது நல்லதுன்னு சொல்லிட்டு நிறைய எடுத்துக்கிறோம். நிறைய எடுக்கிறதுனால என்ன ஆகும்னு சொன்னா it will leads to some toxicity also, or it may cause some over accumulation. So there is a right proportion. We have to take everything in the right time. The another article which supports is about traditional and Ayurvedic food of Indian origin. So this has been published from an USA, and a tie-up from Odisha person. There are several things classified of weaning foods. So what is this weaning food? Weaning food is nothing but which we get for our newborn babies, Cerelac or any other food material. Cerelac 1, 2, 3, they have various stages, right? அதுல இருக்கிறது எதுவுமே இல்லை. They have for first month they used to have some dal, or for second month they used to have some various proportion fruits, apples. They used to say the same thing. I am not against to that, but I am saying that whenever a product is getting prepared, or whenever product is getting processed, automatically there is a need or demand to add some artificial flavoring agent or sweetening agent or preservative. It's a mandatory. It's நமக்கு தெரியாத உண்மை, அது தெரிஞ்ச உண்மையும் கூட சொல்லலாம். There is a mandatory demand is that we have to do it. So instead of going the packed food material, we can do all this content in our home itself. We can dry it and we can powder and we can mix at the time when you are going to feed our baby. So there are several list of weaning foods which can be taken for the babies. This article gives the method of preparation also. If you are reading it, it will be going on. Whatever the articles I have given, I am highlighting only the few important things because each article is highly valuable. I have to discuss one article for more than 1 hour. It is not possible for the time limit. So I'm saying this aspect. And similarly, as I discussed in the earlier stages, based on the various things, Vata, Pitta, Kapha, the cereals, vegetables, spices, nuts, dairy products, whatever we have to take based upon the conditions that has been discussed in this paper. And this ancient food, the bottom, we have two images. Hope everyone will be familiar about this. இது தெரியாதவங்க இருக்க முடியாது. இட்லி, நம்ம ராகி மால்ட் இந்த மாதிரி நம்ம ரெகுலரா சாப்பிட்ற ஐட்டம் தான். So this article has been stating what are the various grains which can be converted into a healthy foods, as well as fruits and vegetables which can be converted into a food. So நம்ம வீட்டில் நார்மலாக செய்வோம். இந்த வாழைப்பூ, பனானா ஸ்டெம், பனானா ஃப்ளவர் அதில் இருக்குல்ல, அதுலேருந்து வாழைப்பூ வடை, வாழைப்பூ பொரியல், சம்திங் யூஸ் டு டூ, மதர்ஸ் யூஸ் டு டூ, வீட்டில் செஞ்சுட்டு இருப்பாங்க. அது செய்யறதுல ஒவ்வொருதுலையும் ஒவ்வொரு பெனிஃபிட்ஸ் இருக்கு. ஸோ தட்ஸ் வாட் த ஹெல்தி திங் விச் இஸ் பின் மென்ஷன் ஹியர். And another, I think this is the last scientific evidence. Let me go on to the next aspect. Spices. So most of the properties of spices, which are using as an ingredient, that will be having a various medicinal properties. So நம்ம பிளைண்டா சொன்னா யாரும் நம்ப மாட்டோம். We need literature support. Only then to promote a good thing, we need a marketing. So let me use this as a marketing strategy. Turmeric, it has anti-inflammatory, diuretic, laxative, good for affection of liver and jaundice, all these diseases. And red pepper, capsicum, as well as garlic, onion, everything, whatever we are preparing, whatever we are having in a day-to-day life has various medicinal activities. Unknowingly, we are taking good things. We have good things. We are cultivating. We are cultivating good things in our land, and that is good for us also. And these spices supports for digestion as digestive stimulation, antimicrobial property, anti-diabetic, anti-lithogenic, anti-inflammatory, antioxidant, anti-mutagenic, anti-cancer, cholesterol lowering, as well as other properties. The same book has been discussed about the curcumin. So turmeric தெரியும், ஒரு காலத்துல நம்ம இந்தியன், ஒரு காலத்துல இல்ல, நம்மளோட பாரம்பரிய ஒரு சொத்து, but it has been patented by foreign countries, and now the patent has been revealed and we have been got back again. So this supports a lot, has a huge activity. Turmericல இருந்து அந்த curcumin என்ற காம்பவுண்ட்ல நிறைய ஆக்டிவிட்டிஸ் இருக்கு. anti-inflammatory, anti-mutagenic, cancer activity, and cardioprotective activity, antioxidant. This relative oxidant species or ROS, that is a most culprit for various diseases. The free oxygen, free radical, that is a major cause for major diseases. So that is being controlled by these various antioxidants in our food materials. And our food, ancient traditional foods, has a various components that supports us for a healthy life. One author, Joel Feuerner, he has been written a super immunity. So based on him, he says that cruciferous vegetable is nothing but the image of what I represented, broccoli or turnip or cauliflower. These are nothing but cruciferous vegetable. These are more powerful immune boosting and health promoting foods. And a statement has been mentioned that eat 3 servings of fresh fruit a day, 8 servings of vegetables, including 2 servings of cruciferous vegetables, and anything taking raw is much better than cooking it. Specifically, chop, chew, and blending. We have to chop, we have to chew, and we have to eat it. We should not take it as there's a thing that than taking a juice, it is better to bite and eat. And mushrooms mainly have a opponent and work against cancer. And onions and garlic, these have a good immunity. That is, while cooking, it will be much better. And a small hint about G-bombs. G-bombs, nothing but greens. Whatever the food which are available in greens that have rich in folates, iron, potassium, calcium, vitamin K, beta carotene, leucine, as well as xanthan. And beans having anthocyanin, flavonol, pure prebiotics, fibers, onions, mainly having some quercetin, mushrooms, vitamin B, D, niacin, as well as ergotin, berries, good in rich in anthocyanins, epicatechins, quercetin, and seeds, nuts, which is rich in zinc, vitamin, iron, selenium. Even in nowadays in COVID, they used to give zinc tablets, multivitamin tablets for boosting your immune system. We can prefer some herbal foods also, herbal spices and black or pure green tea that is very good for health, and fruits, pomegranate and guava. So we have a common thinking that food which has been present in huge rates, such as apple, kg 180 rupees, or pomegranate 180 rupees or 200 rupees, that's good for health. Nothing like that. NIH of Hyderabad, they have been stated that கோவா கொய்யாப்பழம் நம்ம சாப்பிட்ற கொய்யாப்பழம் ஒரு கிலோ 20 ரூபாய்க்கு கிடைக்கும். பட் நம்ம அதை மதிக்க கூட மாட்டோம். But that guava fruit has a n number of health benefits in it. We used to always think about rich fruits, but even the fruits which is available less, that is having a good thing. And turmeric, pepper, honey, amla, டெய்லி ஏதோ ஒரு ரூபத்துல ஒரு ஆம்லா, ஒரு ஜூஸாவோ இல்ல ஒரு சட்னியாவோ இல்ல we can take either in the form of pickle, any aspect. ஆம்லா டெய்லி ஒன்று எடுத்துக்கிட்டோம்னா நம்ம பாடியில இம்யூன் சிஸ்டம் டெவலப் ஆகிட்டே இருக்கும். That is another important thing which has been having over here. Well, as I said that 2 slides related to COVID, and one is about this one, AYUSH. When world is searching for various remedies for COVID, they are trying for CAD, they are trying for various synthetic substances, trying for identifying new molecules, what is the disease, how does the mechanism goes on. We Indians simply think about go back, we gone reverse, and we focused on the various Siddha materials which has been available, Siddha formulations which is available, and even Indian government has been approved having these various formulations which supports for getting recovering or supporting as a complementary or as a health promotion factors of various antiviral formulations in this COVID situation. ஸோ கபசுர குடிநீர் நம்ம கேள்விப்படாத யாருமே இருக்க மாட்டாங்க, எல்லாருமே கேள்விப்பட்டிருப்பாங்க. ஸோ கபசுர குடிநீர், ஈவன் நாட் ஓன்லி இந்தியன்ஸ், ஈவன் ஃபாரினர்ஸ், they used to listen about. It is available in Amazon, it is available in NetMed, everywhere it has been available in online. நிலவேம்பு குடிநீர், ஒரு ஒன் டைம்ல ஒரு காலத்தில் நிலவேம்பு குடிநீர், இந்த when you have dengue, this is one thing which supports a lot to get recovery from it. And விஷசுர குடிநீர், so this is all about it. So கபசுர குடிநீர் ஒரு சின்ன எக்ஸ்பிளனேஷன் சொல்லிடுறேன். nothing but கபம் is nothing but சளி, and சுரா is nothing but ஜுரம். இந்த ஒரு சளி கலந்த ஒரு ஜுரம் இருக்கும்போது இந்த கபசுர குடிநீர் நம்ம குடிச்சோம்னா நமக்கு ஹெல்த்தா இருக்கும். தட்ஸ் வாட் அபவுட் இட். அண்ட் இதுல இருக்கிறதெல்லாம் ரொம்ப பெரிய விஷயங்கள் இல்ல. நிலவேம்பு குடிநீர்ல எல்லாமே நமக்கு தெரிஞ்ச ஒரு காம்பனன்ட் தான். வாட் எவர் த காம்பனன்ட் வி ஹேவ், எவ்ரிதிங் இஸ் விச் இஸ் நோன் டு அஸ். இட் இஸ் நிலவேம்பு மெயின் காம்பனன்ட் விச் இஸ் அ பிரைம் காம்பனன்ட் ஆஃப் இட், அண்ட் காளி மிர்ச், மிளகு which we are having, and all the other components, lavangam, chandana, whatever maybe, sonti, nothing but chukku, inji, kaya vacha inji. So all these things are the components of nilavembu kudineer. This supports for getting delivery from various such as blood disorders, skin diseases, increases the appetite as well as fatty liver, it will be digesting, and intestinal parasite it will be killing, as well as hepatomegaly. These are the various benefits of nilavembu kudineer. We think only for fever. Apart from it, it has a various other benefits for in various activities. And this one, kabasura kudineer, the component which we having chukku, pipili, nothing piper, nothing but lavangam, mulliver, all these components, 15 components will be there recommended in this kabasura kudineer. Let me say one line about it. Before taking anything, we should know the right method to take it. இது நல்லதுன்னு சொல்லிட்டு நம்ம அதிகமாக குடிக்கக்கூடாது. As I said earlier, we can take 2 times a day. We have to take a 50 grams and we have to prep in the 250 ml of water. It has to be boiled or in a warm condition, and it has to be reduced to 1/3. அந்த கொதிக்க வச்சு அதுலயே வந்து 1/3 வால்யூமா வரணும். And we have to take it one time in the morning and night, one time for 3 days, not more than that. That is more than sufficient to make us better for this against antiviral. I'm not mentioning COVID, against antiviral or immunity. We will get an immunity. That's what the benefit of it is. Well, the second part of my presentation is about a carry home message for current and next generation. So whatever the food material, what we have discussed so far, it is having various important direct contact or to our healthy life cycle. But these things, unknowingly, we don't impart or focus much in these areas. These also supports for our healthy lives. The one is about lifestyle management. Another is the packed food or insta food or else junk food, which our youngsters are much prone to it. That is the most problem to us. And next is educational stress, traditional games, and its impact on health system. So saying about the health system, healthy life management, first thing is about physical activities. Recent days, it has been found that the physical activities has been gone very less. Wherever we go, just nearby shop, we used to take our vehicle and we have to go and we have to come. We used to come. We reduce a lot of our walking habits. பக்கத்துல ஒரு நெக்ஸ்ட் ஸ்ட்ரீட் போகணும்னா கூட உடனே பைக் எடுத்துட்டு போறது. தட்ஸ் a normal habitual which has been taken. We have been reduced. காலேஜ்குள்ள லிஃப்ட் யூஸ் பண்றது அண்ட் ஏதாவது மால்ஸ் போனாலும் லிஃப்ட் யூஸ் பண்றது. We used to use that we reduced all our physical activity. We make ourselves lethargic. Once we get lethargic or lazy, automatically our body cells also will get lethargic and lazy, and automatically it lose its activity. If you're active, you'll be doing everything in a right way, right manner. Similarly, if your cell is active, your cell will be doing the thing rightly and perfectly. So let's have a good habit of physical activity, and we let us do all these things. This physical activity supports for overcoming from diabetes mellitus, cancer, obesity, hypertension, bone or joint diseases such as osteoporosis, osteoarthritis. And it has been recommended that at least 150 minutes a week, any one form of physical activity. It's not physical activity means jogging or running. It might be a cycling, or it might be a walking, or it might be swimming. Any other physical activities, a moderate physical activities can be done, or at least 75 minutes per week, a vigorous activity such as climbing faster, playing some games or running. This is recommended, either any one of these things. And similarly, some minimum sedentary time. So making ourselves relax within a particular time, that is important, and improving the balances. So maintaining body posture. There are several dance movements such as salsa or anything else. Dance movement. Adu or type of exercise. We are making our body moving and we are making it to be alert. That's it. It can be in any form. It might be a swimming or walking or cycling or climbing up a stair, or it might be doing any dancing, any other aspect, right? So that will be supporting us to make ourselves free from diseases. And avoiding the risk substances, most importantly, many of us has been addicted, youngsters or any of them has been addicted for risk substances. We have to be away from it. Long-term health effects of alcohol drinking may leads to various problems. The liver மட்டும் கெட்டு போகுன்றது highlight பண்ணிட்டு இருக்கிறோம். Not like that. It affects all the parts of the body in various pattern. It may lead to throat cancer, it may lead to liver damage or lung damage, or even for women, it leads to breast cancer and liver. Passive smoking, I used to say about passive smoking, that means யாரோ ஒருத்தங்க பக்கத்துல ஸ்மோக் பண்றதுனால அது பக்கத்துல இருக்கிற ஃபீமேல்ஸ் யாராவது பஸ் ஸ்டாண்ட்ல இருக்கும்போது if anyone is smoking, it will affect the females also, something like that. And livers and blood and immune system, skin and fats, bone, muscles, it affects all part of the body. Most importantly, it affects mental health and addiction capability. It affects the society as well as his personal family members also. So it's better to be avoid from it, avoiding risk substances such as alcohol, smoking. It make you healthy as well as your family healthy, your society also a healthy level. Sleep, most important topic which I believe make ourselves away from disease, which we are not following regularly nowadays. What is the normal time to sleep? If we ask our ancient person, they used to say once it has been shedding down, the sun sets, they used to complete their food and they used to go for sleep around 7 or 8 o'clock. But now the sleeping time is 10, 11, 12, 1, 2. Depends upon your usage of Facebook, WhatsApp, chatting, all these aspects. it's been habituated for everyone. Not only, I'm not blaming only the students, everyone. ஏதோ ஒரு நிமிஷத்துக்கு ஒருக்காவது வாட்ஸ்அப் பார்க்கலாம் நமக்கு தூக்கம் வராது. ஒரு நிமிஷத்துக்கு ஒருக்காவது ஸ்டேட்டஸ் பார்க்கலாம் நமக்கு தூக்கம் வராது. ஏதோ ஒன்று ஜஸ்ட் ஒரு தடவை பார்த்துடலாமே, பார்த்துட்டு படுத்துடலாமே, அதை பார்ப்போம். அண்ட் தென் இட் வில் பி கண்டினியூங் லைக் தட் ஆஃப் அ காசிப். ஒரு காசிப் மாதிரி எப்படி ஒரு 4 பேர் சேர்ந்தாங்க ஒரு காசிப் ஸ்டார்ட் பண்ணாங்கன்னா அது அப்படியே செயின் லென்த் 1 hour 2 hours போயிட்டு இருக்கும். Similarly, this phone is a huge addiction for us, which disturb us. Imbalanced sleeping will lead to a major problem. And in sleeping, we have to take 12 important things. One is sleeping in dark place. Dark place la தூங்கல அப்படின்றப்போ ஹார்மோன் செக்ரீஷன் அஃபெக்ட் ஆகும். ஹார்மோன் செக்ரீஷன் அஃபெக்ட் ஆகிறப்போ then automatically leads to various problems. We used to see on many articles that young stages they have cardiac problem, diabetes, means mostly software persons. அவங்க என்னன்னா they have night shifts. Nowadays night shift is quite common because we are not working for us, we are working for other country. While they are waking up, we are working. So we are working for them in our wrong time. As we are working in the wrong time, automatically the hormone cycle, everything, our chronobiology will be getting disturbed. When the chronobiology is getting disturbed, body system will be getting disturbed. Very simple. ஒரு சிம்பிளா புரியுற மாதிரி சொல்லணும்னா, கரெக்டாக 12 மணினா எல்லாத்துக்கும் பசிக்க ஆரம்பிச்சிடும். இப்போ ஆல்ரெடி லஞ்ச் டைம் தான், ஐ எம் கெட்டிங் எக்ஸிடெட், ஐ பி கம்ப்ளீட்டிங் வித் 15 minutes, ரைட்? லஞ்ச் டைம் பசிக்க ஆரம்பிச்சிடும். பசிக்க ஆரம்பிக்கிற டயத்தில் நம்ம கரெக்டாக பசிக்கிற டயத்தில் சாப்பிடணும்னா 3 o'clock 4 o'clock சாப்பிட்டீங்கன்னா சாப்பாடு எடுக்காது. பிகாஸ் the hormone secretion has been completed. The cycle, the hormone secretion has been completed. Again, it won't be working in the same way. Likewise, எந்தெந்த நேரத்தில் எந்தெந்த பண்ணணும் அதை கரெக்டாக பண்ணணும். That's most important. Sleeping in the dark places. Do not eat much before going to sleep. We have to finish our dinner right at before sunset, or else 6 o'clock to 7 o'clock. We used to take our dinner right 10 o'clock or 11 o'clock. That's a completely wrong habit. And smoking or alcohol before sleep, that is a wrong habit. We have to take a small walk before bed, and taking caffeine or coffee at night is a wrong thing. And sleeping on a firm or level which is in a comfortable bed, that's a good habit. And favorable temperature, that's also an important aspect. Go to bed and wake up at the same time. இன்னைக்கு ஒர்க், இன்னைக்கு நெட்டை பார்த்து 1 o'clock தூங்கிட்டு நாளைக்கு 10 o'clock தூங்குறீங்கன்னா that's a problem. We have நாளைக்கு day after tomorrow you might have an important appointment in morning. So இன்னைக்கு நான் 10 மணிக்கு தூங்கிடணும், நாளைக்கு காலைல 5 மணிக்கு எந்திக்கணும். We'll be making ourselves prepare. That's a wrong. Have a right sleeping time of 10 to 5. There's a right good time to sleep. Let's try to have a habit from now onwards. And put off your working electrical appliances away from your head. And away from night games விளையாடுறது கண்டிப்பா நிப்பாட்டிக்கணும், or else it will be affecting us when you're going to bed. The same thing, psychological dreams will be getting same thing. And don't focus on insomnia aspect. ஏதோ ஒரு ஸ்ட்ரெஸ், ஏதாவது ஒரு இன்னைக்கு மார்னிங்ல இருந்து உங்களுக்கு காலேஜ் டைம்ல இல்லைன்னா ஒர்க்கிங் அண்ட் பிளேசஸ்ல ஏதோ ஒரு டிஸ்டர்பன்சஸ் இருந்திருக்கும். Don't think that while you're going to sleep. Be away from it and try to have a brush before going to sleep. These are some of the good habits which will support you for a healthy life. And stress, various stress management aspects are there. Listening to music, reading a book, or social network, or meditation, or listening to our grandparents, speaking to our grandparents, speaking to our parents, or speaking to our friends or brothers and sisters. These are all the various aspects which release us away from the stress, right? And intermittent fasting, as I said, the timing of fasting or gap between 2 food meals, it is preferred to be minimum of 12 hours. So night by 8 o'clock if you're having a dinner, and next day morning by 8 o'clock. In between time, we should not take anything. If you're not taking anything, if you're not feeding anything for 12 hours, our body system will be getting adapting to the thing. So 12 hours fasting as well as 12 hours thing. In Western countries, now they have been extended to 18 hours. So 16 to 18 hours, they're extending moreover. So from 8 to 6 hours, they're extending more. Again, from 12 to 16 to 18 improve பண்ணாங்க. What is the benefit in it? என்ன benefit mainly saying about it? It improves appetite control, blood sugar level, cardiovascular function, effectiveness of chemotherapy, neurogenesis, and neuronal plasticity. So these are the various benefits. It will be getting improved, and it reduces the bad cholesterol, blood pressure, inflammation, oxidative stress, and cancer. It increases the cellular turnover and repair, and growth hormone releases and metabolic rate later. So these are all the benefits of intermittent fasting. At least let us start from now to have a 12 hours of gap between dinner and morning breakfast. So that will be supporting our body physical system. And fasting is one most important thing. Any 1 month fasting or whereas in Ramadan time they used to take a 1 month fasting. That is really very good for health. Or having a habituate of having fasting of weekly once, either Saturday or Thursday, whatever maybe, according to a belief. The whatever the belief you have a belief that is based upon your God belief or whatever maybe, but there is a scientific evidence behind everything in the belief of your respective religion. Whatever. So respect your religion, respect your religious instructions. It has a scientific reason behind all the aspects. The next one, dinacharya. சிம்பிளா இதை பத்தி ஒரே வார்த்தை சொல்லணும்னா எந்தெந்த வேலையை எந்தெந்த நேரம் செய்யணுமோ அந்தந்த வேலையை அந்தந்த நேரத்தில் கரெக்டாக செய்யணும், அவ்வளவுதான். That's it. Nothing apart from it. So hope you will be I'll be sharing the slides. It's not nothing personal. You can have this slides. Our body has every action. எல்லாமே ஒரு circadian rhythm. It depends on the biological clock. Whatever the thing we have a biological clock. Our small intestine work at a particular time, bladder work at a particular time, kidney, as well as our liver function, lungs, large intestine, small intestine, everything works at a particular time. So we have to make that particular organ to be get present in a right time. If we say scientifically and physiologically, parasympathetic nervous system, sympathetic nervous system used to say. Whenever you are in a very urge moment or any other stress condition, the sympathetic nervous system will be getting stimulated. Nothing but adrenaline will be getting stimulated. You might be familiar with your schools or anytime. Fight, triple F, fight, flight, fright. Nothing but ஒரு பாம்பை பார்க்குறோன்னா உடனே ஒன்று அதை பார்த்து நம்ம கல்லெடுத்து எரியணும், இல்லைன்னா பயப்படுவோம், இல்லை அங்கேருந்து ஓடி போவோம். That's what fight, flight, fright. Whatever maybe. So அந்த டயத்தில் adrenal secrete ஆகும், sympathetic nervous system secrete ஆகும். So that we will be getting in a tensed manner. Parasympathetic nervous system generally secretes in the normal condition. We have a small simple code such as SLUD. SLUD is nothing but salivation, lacrimation, urination, digestion, defecation. ஸோ இந்த டயத்தில் வந்து எப்பப்போ இந்த இதெல்லாம் நடக்குமோ மீன்ஸ் நைட் தூங்குறப்போ பேராசிம்பத்தட்டிக் நர்வஸ் சிஸ்டம் ப்ரிடாமினண்ட்டாக இருக்கும். ஸோ அந்த டயத்தில் தான் டைஜஷன் நல்லா நடக்கும். ஸோ தட்ஸ் வாட் வி கெட் அ நார்மல் மார்னிங் கால் ஆஃப் டீஃபிகேஷன் ஆர் யூரினேஷன் வாட் எவர் மேபி. ஸோ அந்த டயத்தில் அது ஒர்க் ஆகும். ஸோ தட் இஸ் மோஸ்ட் இம்பார்ட்டன்ட் திங். வி ஹேவ் டு டூ த திங்ஸ் இன் த ரைட் வே, ரைட் டைம், அண்ட் டேக்கிங் பாத், ஆல் தீஸ் திங்ஸ் இன் த ரைட் டைம். The packed food, coming to the last few slides, packed food. I'm not against packed food, but there are some problems in the packed food. Let us know what is it, and let us realize what is it, and let us be away from it. ஒரு ஃபுட்டை ப்ராசஸ் பண்றோம்னா அந்த ஃபுட்டை ப்ராசஸ் பண்ணும்போது அதை சிம்பிளா நம்ம ப்ராசஸ் பண்ண முடியாது. Whenever you are converting it to for a processing in an industrial huge scale process, I'm not saying in the household process. In வீட்டில் நம்ம பண்ற ப்ராசஸிங் ஃபுட்ஸ், ஃபார் எக்ஸாம்பிள் ஸ்ப்ரவுட்டிங், ஏதோ ஒரு சீரியல்ஸ் இருக்கு, அதை நம்ம நைட்டு தண்ணியில் ஒரு போட்டு ஒரு வெட் கிளாத்ல டைப் பண்ணி வைப்போம். தென் இட் வில் பி கன்வெர்ட்டிங் இன்டு இட் வில் பி ஜெர்மினேட்டிங். That's also a processing. I'm not against to that processing. That's a very good type of processing. Sprouting or fermenting, these are all a very good process of processing. But packed food, when a food product is been making to present for a month together, 1 month or 2 months or 3 months, when they are packing it, automatically that food will be losing its natural quality. அதோட இயற்கையான ஒரு தரத்தை நம்ம போகடிச்சிட்டோம்னா ஆட்டோமேட்டிக்லி இட் கெட் அஃபெக்ட் டு த பாடி. ஸோ டு மேக் இட் கிறிஸ்பி ஆர் டு மேக் இட் டேஸ்டி ஆர் டு மேக் இட் அஃபோர்டபுள் டு அஸ், ரிப்பீட்டடாக அதை அட்ராக்ட் பண்ணணும், ஒரு அடிக்ஷன் பண்ணணும் அப்படின்றப்போ they need to add various components such as BPA, phthalates or PFS or perchlorates or artificial food materials, nitrates, all these things. என்ன ப்ராப்ளம் இதனால? இம்யூன் சிஸ்டம் அஃபெக்ட் ஆகும், நர்வஸ் சிஸ்டம் அஃபெக்ட் ஆகும், கார்டியோவாஸ்குலர் சிஸ்டம் அஃபெக்ட் ஆகும், and low birth weight, babies low birth weight form either pregnant ladies, if they are taking this PFC's packed food material, it leads to affect the next generation, low birth weight, and thyroid, infertility, as well as brain development, early brain development, it will be affecting this percolate. And this one, noodles, some packed noodles ஒரு சில ஒரு டைம்ல வந்து பேன் பண்ணாங்க, mainly due to this MSG. So monosodium glutamate. The monosodium glutamate mainly it affects, damages the cells, it results in overeating. நம்ம அடிக்ஷன் ஆயிரும். எதுக்கு அந்த நூடுல்ஸை திருப்பி சாப்பிட்றோம் அப்படின்னா அதுல ஒரு பர்டிகுலர் காம்பனன்ட் that is nothing but if you are taking that we will be getting addicted to that. நீங்க வேணா இந்த மோனோசோடியம் குளுக்கேட் அவைலபிள் இருக்கும். நீங்க வீட்டில் ஒரு ஃபுட் மெட்டீரியல் பண்ணுங்க. யூ ப்ரிப்பேர் ஃபுட் மெட்டீரியல் இன் த ஹோம். You prepare in a normal pattern and you add this MSG to that. அதில் அஜனமோட்டோ நத்திங் பட் அதை அப்படி ஆட் பண்ணிட்டீங்கன்னா அது ஒரு செப்பரேட் ஃப்ளேவர் கொடுத்துரும். இந்த நார்மல் ஃபுட்டுக்கும் அதுக்கும் ஒரே ஃபுட் மெட்டீரியல் வாட் எவர் மேபி ஒரே ஃபுட் மெட்டீரியலில் ஒன்று எம்எஸ்ஜி ஆட் பண்ணி ஒன்று எம்எஸ்ஜி ஆட் பண்ணாமல் ப்ரிப்பேர் பண்ணி பாருங்க. அந்த எம்எஸ்ஜி ஆட் பண்ணாதான் நமக்கு வந்து நல்லதா தெரியும். வில் பி அடிக்டிங் டு இட். ஸோ தட் இஸ் அ மேஜர் ப்ராப்ளம். வி ஷுட் நாட் யூஸ் இட். And potassium bromate, it leads to cancer, but it is available in several packed material. Sodium benzoate and headaches, which leads to some stomach upset, all these aspects. So let's be away from packed food materials or junk food materials. இன்னும் சொல்ல போனா இந்த ஜங்க் ஃபுட் மெட்டீரியல்ஸ்ன்றது பேக் ஃபுட் மெட்டீரியல்ஸ் வந்து இந்தியன் ட்ரெடிஷனே கிடையாது. இட்ஸ் நாட் அட் ஆல் இந்தியன் ட்ரெடிஷன். we won't has it use it at all. So let's be away from it and go back about the tradition. Educational stress. Nowadays the current generation ஏதோ ஒன்று சாதிச்சிடணும்னு சொல்லிட்டு ராக்கெட் சயின்ஸ் கற்றுக்கணும்னு சொல்லிட்டு நேச்சுரல் சயின்ஸை விட்டு போய்கிட்டு இருக்கிறோம். ஸோ வி ஹாவ் டு டூ ராக்கெட் சயின்ஸ் ஆல்சோ, பட் வி ஹாவ் டு டூ த நேச்சுரல் சயின்ஸ் ஆல்சோ. ஸோ செகண்ட் ஸ்டாண்டர்ட் படிக்கிற பசங்களுக்கே வி யூஸ் டு ஹேவ் ஆல் தீஸ் ஆக்டிவிட்டிஸ். மியூசிக்கல் பாட்டு பாடணும், சூப்பர் சிங்கர் ஆகணும், அது மாதிரி ஃபேமஸ் பர்சன் ஆகணும், எக்ஸ் ஃபேக்டர் அதில் போய் ப்ரொமோட் ஆகி தே ஷுட் கெட் international forum, international platform la periya ala varano. They should nowadays, recently we are seeing coding for school children's. Coding அந்த வயசுல அவன் கோடிங் பண்ணி என்ன பண்ண போறான்? பட் parents are proud of it. My son coded this game, my son coded this game. What is natural, what is coming for him, let us do that. அவனுக்கு என்ன வருதோ, அவங்க நம்ம சில்ட்ரன்ஸ்க்கு என்ன வருதோ, let us try to adapt them to that their interest, not import whatever all our interest. So that's what about it. The impacts of game. Recently several games has been banned. PUBG or whatever maybe recent several issues has been going on to remove some games from online sectors. These are the problems. Let me shoot out some benefits of the existing games. Than blaming these games, let me shoot out some examples of these games. So first one, you know about it, Pallanguli. So this, all the ancient games what we have is not imparting only for time sake, the time pass. It has its reason behind it. It has its enough valid reason behind it. So this first one, Pallanguli, it supports for distributing what you have with you to others. So இருக்கும் இடத்துல இருந்தே எடுத்துட்டு எல்லாதவங்களுக்கு போய் கொடுக்குற குணம், எல்லா இடத்துக்கும் இல்லாதவங்களுக்கு கொடுக்குற குணம் வந்து இந்த பல்லாங்குழியில இருக்கு. The next is about தாயம். So it is nothing but when one is defeating you, you have the capability and courage to regain it and come back again it. யாராவது ஒருத்தவங்களை உங்களை விளையாட்டுல வெட்டிட்டாங்க மீன்ஸ் அந்த கேம்ல அதான் ப்ரொசீஜரு. வெட்டினாலும் மீண்டு வரக்கூடிய விடாமுயற்சி இந்த கேம்ல வந்து ஒரு மேஜர் திங். நெக்ஸ்ட் இஸ் பரமபதம். This is it denotes that in life we have a lot of up and down. Whatever the up and down, it is common in life. We have to climb it, we have to face it, and we have to come to the right position. ஏற்ற இறக்கம் ரெண்டுமே இருப்பதுதான் வாழ்க்கை. அதை உணர்த்துற ஒரு கேம் தான் this particular aspect. And the next is the fourth one. What we generally say is about ஏழுக்கல் எறிதல். This develops patience and repeated struggling for all those things. பொறுமை, விடாமுயற்சி, and same thing, targeting will be getting out. Also make the while playing this, we used to sweat a lot so that unwanted toxic substances will be getting eliminated away from the body. And the next is about the generally we used to do in the schools. While they playing this one, we will be getting bone strength in a better way, leg strength in a better way. At the same time, breathing will be better. So this is what. And the next is Udi Thalle. So in this, breath control will be there. So any asthma or any problem won't be there in the children. Child life la நம்ம இந்த மாதிரி பண்ணிட்டோம்னா breath control நமக்கு வரும். அது ஒரு indirect meditation மாதிரி, இந்த ஒரு கேம்ல indirect meditation மாதிரி. And the seventh one, what we are seeing, ஆடுபுலியாட்டம். So here it develops courage as well as depresses our overconfidence. தன்னம்பிக்கையை வளர்க்கும், அதே சமயம் தலைக்கணத்தை குறைக்கும் and புத்தி கூர்மையை உண்டாக்கும். It enhances concentration power. And the game which is 8, it is nothing but Kataikal. So responsible for good bone development and responsible for coordination. கையை கால் ரெண்டையும் கோஆர்டினேட் பண்ணி யூஸ் பண்றது. And the next one is a ninth one is nothing but கிச்சு கிச்சு தாம்பலம் இதெல்லாம் தெரிஞ்சிருக்கும்னு நினைக்கிறேன். ஸோ ரெஸ்பான்சிபிள் ஃபார் intellectuality, knowing where the hidden item is there, will be able to identify. And this one, rope, pulling rope, bone strength, as well as repeated condition. Recent FB la or idu vandirukku. I think it is from Japan. One person used to struggle a lot in one end, and will pull it, and he will be struggling to the last end. Nothing but making him to courage and bone strength as well as coordination. This is supporting. And skipping, the third one, responsible for coordination, health benefits, all aspects. And the fourth one, மோஸ்ட்லி இது ஒரு சின்ன கேம் நம்ம நினைச்சிட்டு இருப்போம். அந்த கேம்ல நிறைய பெனிஃபிட்ஸ் இருக்கு. ஐஸ் பவர் வில் பி கெட்டிங் என்ஹான்ஸ். அண்ட் யுவர் ஒன் எவர் யூ ஆர் டூயிங், தே யூஸ் டு சே இந்த நாலாவது கல் எடு அப்படிம்பாங்க. தே யூஸ் டு டேக் ஃபோர்த் ஸ்டோன். Then we will be making it to fly at the top, and we'll be catching exactly the right one. So buddhi kurmai, and at the same time someone will be singing without leaving the breath. So breath control, all these things. And the gilli, you know that this is what giving a various right aspect and power. Cricket oda munnodi kuri paarkradhu and alavettukuna inga irundhu nama will be striking it, and will be going along. We'll be predicting some distance. What will be the distance from here to that? We'll be saying 100 feet, something like. So they'll be counting the value. So buddhi kurmai, alavidudal, idella indhula varum. So this is what about it. And coming to the conclusion of topic, history returns. ஒரு காலத்துல மன்னர் பரம்பரையில் இந்த மாதிரி தனித்தனி உட்கார்ந்தாங்க. சோஷியல் டிஸ்டன்சிங் has been followed in the old age and ancient days. That's what following in nowadays. And in the initial stages of corona, we used to feel fear about corona, and we have a lot of health conscious in the month of March and April. And as time goes on, our health conscious gets gradually reduces. Is it right? I hope I am right. Initial, in the case of month immediate of, we have been finding of kabasura kudnir, we are finding of various food materials, cereals, nuts, and we are taking of regular turmeric in the milk. Daily night எடுத்துக்கிற மில்க்ல மிளகு பனங்கல்கண்டு எல்லாம் போட்டு சாப்பிட்ற பழக்கம் எல்லாமே மார்ச்ல ரொம்ப தீவிரமா கடைபிடிச்சோம். As time goes on, we lose it. We lost all these things, and now social distancing is not there, mask wearing is not there, everything has been overcome. We have been away from it. Let's follow the rules, let's follow the thing, and than all these things, let's look back our tradition, let's look back our traditional person, ancient person, and let's follow the good what is present in it. திரும்பி பார்த்தா எல்லாமே நன்மை தான், எல்லாமே நல்லது தான். அந்த நல்லதை எடுத்துட்டு நல்லதே செய்வோம். To acknowledge it, my humble and heartful thanks to the management of Karpagam Education Trust, and a special thanks to Dr. Mohan, Principal, Karpagam College of Pharmacy. And I thank my colleagues and well-wishers for their support and encouragement. A heartful thanks to Mrs. Anitha, ANCP of Andhra Pradesh, and Mr. Ravi. Most of the content has been shared from their supports are there. A special thanks to my family doctors, my parents, grandparents, and wife. A heartful thanks for the wonderful online audience. And it's about I won't be justified if I'm not thanking Dr. S Saravanan, Dean at Admin, Professor Dr. V. Rajendran, Principal, and the team of him, and Dr. S. Gowri, Head Department of Biochemistry, and organizer of COVID-19 Redressal Cell of Dr. NGP, Arts and Science College, Coimbatore. And all these slides is a contribution of many researchers. Thanks to each one of them, and the various online sources available, all these Google Meet or whatever may be. And thanks to Dr. G. Saravanan. So many of might seen his speech in YouTube, the Managing Director and Chief Siddha for Arogya Healthcare. Most of today's content will be an impression or an impact of his delivery talk. Last but the prime most, I thank the Indian traditional system and farmers in aspect of wisdom, food, health, safety, and so on. Thank you all. Thank you for your valuable time and your suggestions, please. I hope there won't be any questions. There will be a lot of suggestions, I think so, because it's not a new topic. It's the topic which is familiar to all of us. Over to the organizing committee.
Thank you, sir. It has been an insightful lecture on food, nutrition, and healthy lifestyle. We feel that you have created a fertile ground for building healthy lifestyle using food and healthy practices. Thank you for holding the perfect space for us to unfold our unresolved questions on food, healthy lifestyle, and practices. Thank you, sir, very much. And it's time for question and answer session. We request the participants to ask their queries.
Yeah, I hope this is a general topic, and than that, let me conclude one thing as a common statement to this ending session. One is about whatever the food material available in and around us. நமக்கு சுத்தி அவைலபிளா இருக்கிறத மட்டும் நம்ம ஃபோக்கஸ் பண்ணாலே போதும். அது மேஜர் இம்பார்ட்டன்ட் ஆஸ்பெக்ட். வாட் எவர் அவைலபிள் இன் அரௌண்ட் அஸ் அரௌண்ட் 100 கிலோமீட்டர்ஸ். நான் இது ஒன்று நார்த் இந்தியாவில் ஒன்று அவைலபிள்னா அதை போய் நம்ம எடுத்து சாப்பிடணுன்ற அவசியம் இல்லை. நம்ம ஏரியாவில் என்ன அவைலபிளோ அதை எடுத்தா சாப்பிட்டா போதும். இல்லை அதே மாதிரி we can accept the foreign food whatever may be just as a just for an change of taste, but we should not change the taste to that. That's what the main thing which I like to conclude, and we can use it for a better healthy life aspect. So any other questions or anything we can discuss about it from your side? And to the organizing committee, if anyone requests the slides, no issue. I will share it to you after to Dr. Gowri and Dr. G. Gowri. So if anyone needs, you can share the slides also. That's what from my side.
Yes, sir. Thank you, sir. So you persisted on the saying that unave marunda, and we were very grateful for your presentation, sir. So I would like to deliver my vote of thanks on this occasion. The best and beautiful thing in the world cannot be seen or even touched. They must be felt by heart. Thank you is one such prayer among them. I consider it is a great privilege to propose vote of thanks on this occasion. Today, my words are not enough to express my gratitude to Dr. S. Ramkant, Professor and Head, Department of Pharmaceutics, Karpagam College of Pharmacy, to Grace, who has graced this occasion with her thought-provoking address. Thank you so much, sir. We have been fortunate enough to be backed by our beloved principal, Dr. V. Rajendran, who has been in constant support and gave us a lot of encouragement. Thank you so for his absence. I would like to thank my sincere thanks to deans of various portfolios who always support us. I would also take this opportunity to place my record of thanks to various heads and faculty members of various departments and also the faculty members from other colleges. I finally thank the student fraternity to joining us in this occasion. I once again thank you everyone for making this program successful. Thank you.
Thank you, ma'am. Thank you for the conversation. Thank you. I am leaving the meet.
Thank you, sir. Ramkant sir, thank you so much. Really, it's a wonderful. So, our traditional practice, you explained in a scientific way. Thank you so much, sir. So, once the COVID situations are over, we are going to welcome you all to our campus also for your future sessions. Thank you so much, sir.
Sure, ma'am. Thanks for the opportunity, ma'am. Thank you.
Okay. Thank you, sir. Thank you, sir. Thank you so much.